Hello, everyone. My name is Tina. I'm the founder of Simple Steps Fertility. I'm very excited with our podcast today as we discuss a really important part of third party surrogacy, egg donation, which is the mental health aspect of things. And today I'm so excited to introduce Joey from Counseling with Joey and Associates. Thank you, Joey, for being here with us.
Thank you, Tina, for inviting me to be a part of this amazing podcast.
Great. I would love to hear a little bit about your company and what you do. You're a wonderful group of people, and if you can just share with us what type of patients you have and services you offer, that would be wonderful.
Sure, absolutely. So, here at Counseling with Joey and Associates, we're a group practice that specializes in third-party reproduction and infertility. And so we do counseling, and for all folks who want to process their, fertility and fertility journeys and experiences. We also assist with doing mental health screening for surrogates, egg donors, sperm donors. We do intended parent or recipient parent psychoeducational consultations. We do support sessions. We do joint sessions. So we do a lot pertaining to the field of reproductive, third-party reproduction or infertility.
Thank you. I'm so happy you mentioned so much because as I've been doing this for about 20 years. I've been in the industry, and I think so much more is needed in the mental health space to help support surrogates and egg donors and intended parents. At our agency, we kind of restructured and we kind of moved up the mental health evaluations to be sort of the first thing people do as a starting point. Can you tell us a little bit about what are, how do you go about doing an evaluation? What are you looking for? What's the goal? Why it's so important?
Yes. So, I'm happy to hear that you have moved up the mental health aspect to the beginning of your process, because I do believe that mental health should be at the beginning of the process, because it does allow for conversations to happen, whether if it's with the intended parent or recipient parent, the egg donor, sperm donor, gestational carrier, where you can really process what the implications are for the participation that you're going to be having with that third-party reproductive process. There's a lot of psychoeducation involved at every aspect, even if you're being evaluated for, to become a surrogate or a donor. There's a lot of psychoeducation that is provided so that everyone can make informed decisions. You won't be able to make informed decisions or even provide full informed consent if you don't know what you don't know. So speaking with a mental health provider at the beginning can give you that those pieces of information that are vital for you to be able to make informed decisions. Now, when we are conducting screenings, we're really assessing for everyone's readiness, emotional, psychological wellness for this process, which is third-party reproduction, surrogacy, or egg or sperm donation. We really want to understand from these individuals, are you ready for this process emotionally and psychologically? What do you know about the process? Because the decisions that they're making today aren't just decisions that are going to stay within this moment. They're going to be carried on for the remainder of the journey and even for the rest of your life. So we want to make sure that everyone understands what the implications are, how prepared they are, what their support network looks like, because support is also a huge key in this whole process.
Yeah, absolutely. I mean, we are having a little bit of a tough time, I think, in the beginning, because we really thought it was, because it's obviously understandable why a surrogate would go through a psychological evaluation and also an egg donor, because we're, trying to identify certain things. But it's so important for intended parents to also, I wouldn't even want to call it a psychological evaluation. We'd call it like a mental health check-in, because I think when intended parents have the opportunity to meet with a mental health provider in the beginning, it kind of manages expectations at some level. It gives them a little bit of emotional strength, I believe, or at least building blocks to obtain emotional strength, because sometimes intended parents don't really realize how difficult this is all going to be as things progress. How do you feel about intended parents having that meeting with the mental health provider in the very beginning to manage expectations?
Well, I think it's highly important that they meet with a mental health provider at the beginning of their journey. And not just because I think that's like the right thing, but it's also the standard of care. Intended parents, and I have to say something. I've been an intended parent, so I've been through surrogacy twice. I'm a dad to two daughters through surrogacy and egg donation, so I know what that feels like personally. And even as a mental health provider, when I met with a mental health provider to review the aspects of surrogacy, I was blown away by things I wasn't aware of. That mental health provider that I met with helped me prepare for certain aspects for the journey. And so I do believe that it is important for recipient intended parents to meet with a mental health provider at the beginning, because it does allow for them to come in to ask the questions that they need to ask, so that they're provided with information, psychoeducation about what they should be expecting. Expectations should be set because you need those expectations so that you can navigate the journey smoothly. Again, so that consultation, it isn't really about evaluating whether if you're going to be a good parent or not. And I think a lot of intended parents, they're turned off by meeting with a mental health provider because they're asking themselves, why do I need to go through this? And really it's about you meeting with someone to go over what your thoughts are, your expectations about this process, because sometimes some expectations might not be realistic for surrogacy. And so the mental health provider will be able to help you set realistic expectations, because the expectations that you have as an intended parent are going to impact the surrogate and the whole process. So you want to make sure that your expectations are not realistic, and you also want to understand that you are going to be working with someone else, and your thoughts, your emotions are going to be impacting this other person who is going to be potentially carrying your child. So there's much more than just going through the process, having a child. Like, you are dealing with other individuals, and it's an emotional and relational experience. So in that mental health consultation, you're also going to realize these things that you probably did not realize before.
Yeah, absolutely. I'm so happy you said it that way, where I truly believe that initially intended parents feel like they're going to be evaluated to see if they're going to be good parents, or if that has something to do with the process. But we really just want them to have a conversation about the journey and expectations, because it's such an emotional ride. And we see that in the beginning, intended parents and surrogates, especially since they have a relationship, sometimes egg donation is an anonymous process, but with surrogacy in particular, when in the beginning everyone's so excited, everyone's so positive, everybody, and we really want that energy. And as you see, as the journey progresses and you have these little bumps in the road, and when you try to address things, I think in the very beginning it makes those bumps a little bit easier to go over. And so that's something else I wanted to discuss. Whenever you do have like these little bumps, and they can kind of gather and gather and gather, and then I would think it would be best to kind of have these small conversations as things are happening to resolve them. But how do you think it's best for surrogates and intended parents to resolve issues once they kind of start having those little bumps begin in the very beginning?
Yeah, well, and before I answer that, I want to just go back and say that that mental health screening or mental health consultation that some intended parents have with the mental health provider, it's really about emotional preparation, and it's a collaborative conversation that they have with the mental health provider. Again, it's not an evaluation where I'm not again trying to determine whether if you're going to be a good parent or not, but it's more about like, let's look at the overall picture. How can we prepare you with the tools to navigate something that's so complex? And now when it comes to like the relational aspect, where the surrogate and the intended parents may be having some bumps along the road, there might be some disagreements or some conflict. Communication. I mean, really, communication is the best key here. Remember earlier I said this is a relational experience. And so part of that mental health screening, part of the mental health consultation is to prepare both parties to be comfortable with communication, because you're getting into a relationship. And every relationship requires communication, boundaries to be able to have a healthy relationship. So communication is going to be highly important in your relationship with the surrogate, in your relationship with the intended parents, because it's going to be like the same type of relationship that you have with your friends, your family members, your wife, your husband, your spouse. So it's no different. Communication is going to be key. And hopefully, if you need support to have conversations that might be challenging, that is when a mental health provider can really help out in coming in and having a supportive conversation between all parties, and hopefully getting to a resolve of what the conflict may be. Now, apart from the individual mental health consultations for the intended parents or the screenings for the surrogates, there's also a joint consultation that is also a standard of care. It is part of the ASRM guideline. I think that joint consultation should also happen at the beginning, so that those expectations that you discuss with the mental health provider in your own individual settings, that you can come back into the group setting and review these expectations to make sure, are we all in alignment with what the expectations are? And that is also a great setting to discuss difficult things that maybe haven't been addressed yet, so that you are able to navigate your relationship and the journey as best as possible, because you've already identified maybe some of the challenges that that you may face. Or one of the things that I like to bring up that could be something that could be difficult, is termination of pregnancy, or how you want to be supported after you've experienced an unsuccessful transfer, potentially a miscarriage, or something with a termination. That could be something that's challenging for all parties, and I really address with them, how do you want to be supported by one another if something like this were to happen? Like, how do you want to communicate? Because there could be a tendency for both parties to pull away, because they're all going through their own experience, their own loss, their own grief, and you don't know how to support one another, and you might be then assuming, oh, they don't want to talk to me, or oh, I don't want to intrude on if something's going on, and then the other party thinks, oh, they're not communicating with me, and then that can create another potential issue. So we address, how do you want to, support each other? Do you want a phone call after something like this happens? Do you want a text message? How do you want to communicate? Do you need space? That way they can hear directly from one another what their need is, so that they can meet each other's need. And in relationships, we want to meet each other's needs to feel healthy in the relationship, to feel seen, to feel validated.
Yeah, absolutely. It seems like you're trying to be polite and give somebody space, but that person might actually just want you to reach out and say hello. So you're absolutely right. Something I also want to say from the agency perspective, what's important to us and why we rely on mental health, providers to help us, is possible red flags. Is everybody ready to go through a third-party IVF cycle? Are there intended parents that have to think about, is surrogacy right for them? Do you see these type of red flags during evaluations?
So if we're talking about recipient parents, intended parents, yes, sometimes there could be red flags. I don't run into them often, but sometimes there are things that are highly concerning that I need to highlight for you as the agency to be aware of. Maybe this couple might need additional counseling before they move forward with surrogacy. Sometimes there could be things relational instability, or intimate partner violence that needs to be highlighted. These things need to be addressed first, and hopefully resolved before they can continue with something like surrogacy. Because surrogacy is challenging. Surrogacy is emotionally and psychologically demanding, and we don't want something like surrogacy to further, worsen the situation that's going on in the relationship with the recipient intended parents.
Yeah, absolutely. And the important thing, I think, is there is that ability to help them get there. Of course, if there is not a severe issue, but there are tools to help. From an agency perspective, we always want to be able to help intended parents understand how important this process is to engage in mental health support, because they don't realize how emotional things can possibly get. Something that we see that we are always trying to try to see how we can problem solve from the agency's perspective is when the journey progresses, sometimes intended parents become a little bit more, they begin to micromanage a little bit more, or things are a little bit more transactional, or an employee type of relationship starts to, and we want to help both sides understand that this is more than just that. This is, so what is your advice for this type of scenario?
Yeah, and again, this is why mental health is important to be sought out at the beginning. Because when we're talking about setting the expectations, that's part of the conversation, is also understanding that this isn't a business transaction, that you are dealing with other human beings. We, as intended parents, we don't own the surrogate, we don't, own their uterus, they're not our employees. Like, this is a different type of contract, legal agreement that we're going into. It's one that's much more relational piece. Now, if both parties decide that they want to have that type of relationship where it's more transactional, then they're in their every right to move forward with it as such. But it is my experience that most people don't want that type of relationship. And so when you are going through your mental health screening again, or your mental health consultation for intended parents, that is where we talk about what does it feel like to have a lack of control, because we have a lack of control, and what anxieties might come up, and what is your narrative, like what are you telling yourself, because we also want to make sure that they understand that when you start to let your anxieties take over, that can result in being a helicopter parent, or someone who wants to micromanage, and that might not sit well with the gestational carrier. That, we want to talk about boundaries, and why it's important for us to also understand like what our coping skills are. Like, we want to have coping skills, we want to have outlets that are going to help us navigate our own anxiety, so that we're not putting our anxieties onto the surrogate, all right, because then our behaviors are going to impact her. And one thing that I want to highlight too is that our anxieties, if we place them on the surrogate in form of like micromanaging or just being very rigid, that can stress her out, and that can totally impact her health and the pregnancy. So we don't want to harm the pregnancy, so we want to understand what can we do on our end to face our own anxiety. How do we control that? Again, a support system is highly important, making sure that we're able to speak to other people to help us through the anxieties that we can experience because of the lack of control that we have in this process. And it's scary, it's really scary. But that's why mental health is important, again, to be sought out at the beginning, so that this conversation can be had, and hopefully the intended parents are able to understand these aspects so that they navigate the relationship in a healthy way and not have to go into helicopter mode or micromanaging mode, because it doesn't make it easy for anyone.
Yeah, absolutely. I'm glad you also mentioned boundaries. I think it's very important and it helps the process. How do you think, or what type of healthy boundaries do you think should begin to form from, per se, let's talk about the surrogate first. What boundaries do you think will help the surrogate for her to kind of initiate and keep in mind when she's beginning a surrogacy journey?
Well, I think it just depends, Tina. I think it depends on every individual, like what their boundaries are. I think it's important to set boundaries for sure, but I think it goes back to, like, again, understanding what the expectation is, right? So, like, what does communication look like? How often do you want to communicate, right? So, like, if a surrogate feels uncomfortable with the intended parents, calling her at all times throughout the day, then that would be a boundary to be set. Like, I'm very much open to having communication, but maybe while I'm at work, maybe from 8 to 5, that's my boundary. Like, I can't respond to your text messages, or I can't answer your phone calls, but after 6 o'clock, I'm more than happy, right, to take on these calls and stuff. So I think it really depends on what each individual is comfortable with. Again, going back to the beginning, expectations, understanding what you're comfortable with and what you're not comfortable with, and being able to express that and setting that boundary. I think boundaries should be set at the beginning as part of the expectation, so that everyone understands, again, what they're agreeing to, what they're comfortable with, and what they're not comfortable with.
Yeah, sounds correct. We tried to do that with the match call in the very beginning, where we tried to make sure that everybody has, their values aligned. We talk about, therapeutic abortion, selective reduction, vaccines, ideal forms of communication. Are you okay with somebody being there in the delivery room, not attending appointments? These type of questions. The match call, which is for anyone who doesn't know, it's in the very beginning when the initial match is being made. Do you recommend having the parents having their mental health check-in before the match call and sort of having the group after the match call, the joint session after the match call, or do you think both of that should take place before the match call?
Well, I, I think that it would be important to meet with the mental health provider potentially before the match call, because again, if you have a match call and everything seems great there, right? And then they go back into their own mental health counseling sessions, and they realize, things about the match call that they were not okay with, then you kind of have to go back and, I don't know, maybe undo the match. I don't know how healthy that would be or not. But again, I think, making sure that everybody meets with the mental health provider first gives them like that, awareness, that education, so that when they go into the match call, they know what they're looking for, they know what questions to ask. So I think from a mental health standpoint, and knowing what, the surrogacy process looks like, I think it would be great to have those conversations with the mental health provider before they're being matched.
Yeah, sounds good. At least it gives them, intended parents and surrogates, sort of seeds for thought. It plants important things that they might have learned during the mental health session to think about and, kind of bring up during the match call. So I agree with you there. I'd like to kind of take a little detour and go to a little bit to egg donation.
Sure.
We also work with a lot of egg donors and intended parents. And, in the 20 years, I've never really had an intended parent who said, I wish I never did this before. Everyone is so happy and so delighted with their family. And but do you, when you do the evaluation, I recently had a case where we had one intended parent who had difficulty bonding with the child. And I just, as an agency, want to think back and see, were there some red flags that we could have caught? What can we do to help? How do you deal with intended parents that are afraid of this exact scenario sometimes?
Well, we definitely bring up this scenario when we're using egg donors or sperm donors, right? When we're not using our own genetic material, we definitely sit down and we talk about what that might be like for them. What have you thought about? What are some of the discussions that you've had amongst each other if you're going into this process, coupled, or if you're single, like, have you thought about what that might be like? Like, how did you decide that you wanted to go through this process, and what would it be like for you, once you do have your child? Do you think it might be, difficult for you to emotionally bond with your child? We ask questions to understand where they're at currently, emotionally, psychologically with this process. If there are, again, concerns, things where it might make me, worried for them, I would highlight that. I would, in my recommendation, my report to you, I would let you know, this person might need additional counseling, to further process their grief or their loss around, not being able to have that genetic connection with their child.
Yeah. So
I'm gonna stop really quick. I need to wipe my nose, and I don't want to.
Sure.
Okay, now there we go.
Of course. And that's, I think that's part of the process. I think with egg donation, it's a little bit of grief that people have, as you know, the grief comes with not being able to use their own genetic material. And I really think that those intended parents also would benefit from the beginning to see a mental health provider. There's a, you know, as we go to these conferences and as, you know, as time has passed, I remember when my first cycle with an egg donor, now the child is almost 20 years old.
Wow.
And so now, you know, I really want to have a conversation because I'm very curious and about parents who choose and not to choose to disclose that the child was donor conceived. Do you have any recommendations for the intended parents as in the beginning, as they're, you know, choosing their egg donor and going through the process? And also, how would they kind of go about when is a good time to have a conversation with the child? You know, just to have a conversation about this, if you've had experience with patients going through something like that.
So we definitely discuss this in our mental health consultations. Disclosure: what's the best approach? When do you do it? How do you go about it? How do you go about it? And you know, are you okay with it or are you not okay with it? And if you're not, then we need to discuss like why is this, like just to understand their thought process. But you know, research, you know, shows that when you disclose information about the donor conceived child's origins through egg donor, sperm donor, surrogacy, that this ultimately helps their emotional and psychological wellness. You know, they have a healthier, you know, process when they're going through their identity formation process. There are studies that prove this. Just like, you know, with adoption, you know, disclosure, the sooner you do it, you know, the healthier the outcome will be. And it's the same thing with surrogacy and egg donation or sperm donation is, you know, disclosure to your child about, you know, their origins is going to be highly important. Now, again, early is better. For me, when I meet with my clients, I exaggerate that a little bit. I let them know that, like, hey, if your baby is, you know, born today, you should start today, and you can start by, you know, reading these books about surrogacy and gamete donation to your children. And even though they're not going to understand what you're reading currently because they're infants, that is okay. But really, that first year, I believe it's more for us to get in the habit of practicing what it feels like to read this book that is disclosing information about their origin, right? So that we can deal with our own emotions and thoughts around like what this process looks like. You know, it's about us getting comfortable with the material, fluent with the language, so that when our children, you know, transition from infancy into the toddler stage, that hopefully we feel more confident in being able to share this information by reading books and then personalizing the stories so that the children start to understand that these books are about them, right? And so I believe that tends to like normalize everything very early on, so that the children understand that there's nothing abnormal about the process. It could be different, but it's normal, and it will be normal for them because it's what they've known from the beginning, right? Transparency is healthy, and children tend to do well with that. I think sometimes people might feel that, you know, oh, they're not going to understand, you know, we need to wait until they're older. But the thing is that, you know, when they're older and they don't have this information, especially if we're dealing with like heterosexual couples where things can be masked, you know, a child is going to have to like restructure their brain into understanding that their life is different now, because now there's a huge piece of information that you're giving them at a later time, which could be emotionally and psychologically causing like an injury to them, because now they have to deal with like this new piece of information that parents didn't give me when, you know, I was younger. And so that can be hard, and that can cause a whole thing of a slew of things, emotionally and psychologically for that child. It could also cause a rupture between, you know, the relationship between child and parent. There's just a lot of things. So I think, you know, for me, I've watched both my girls grow up with what I'm sharing with you. Like I started reading these books from the beginning because I was just like, I don't know what to do, but I'm gonna do this. I know that the research says start early. I'm starting now. And I have a 6-year-old and a 2.5-year-old, and both my girls understand their story. They understand that they have an egg donor. They understand that, you know, there is a woman who we refer to as their auntie, who had them, and every time we have a babysitter who comes over, especially if there's like a new babysitter that we're using, they want to share their surrogacy story. So I have to like let the babysitter know, oh, just to let you know, because they're really well aware. And so I see how healthy they're developing with the information, having had that information from day one.
Wow.
And so my kids could be at school if there's an awkward question that's being asked. I am confident that they will do well in responding to those questions.
Wow, that's a really interesting. I had never heard of that tactic, but you're absolutely right. It's, I think, helps the parent, and you're in the industry. Imagine you are, familiar with these terms and this process, and for a parent who has nothing to do with it, and they have to kind of get used to, the ideas and saying these words, and yeah, reading to them is kind of helping yourself understand and be comfortable with so that when it's time to really tell the story, it's a little bit more fluid.
Yes. So again, I would recommend, starting from the beginning, disclosing this information, because it's also not just about disclosure, it's about ongoing conversation. So at every, like yearly mark, so at a birthday for my kids, I expand more on the conversation. So it's not just about reading the books, because they still love those books, like they still want me to read those books, and I still read them to them, but then I expand on the conversation so that they can continue to learn and grow with the information that I'm giving them. And I'll continue to speak to them about it, ongoing. And if they have questions, I'm more than happy to have questions. But it's important to understand that it's not just like a one-time thing, like we're going to share this one time, we're going to read this book this one time. Consistency, ongoing conversations, reading is highly important. And we go through this in our mental health consultations. We bring this up, we provide this information, we bring in information about the research that we have, and then, if they are okay, then I can share my own experience of what I've actually seen with my kids.
Yeah, absolutely. So, as like a mental health professional and somebody who, what would be some advice to give, especially surrogates, when they're beginning their journey? Well, if you had one thing to advise them that this is really important, with everything that's going on in surrogacy these days, with all the controversy that we've seen, all the difficult scenarios we see in the news, and there are agencies that are really trying to have everything, do things ethically, transparently, provide support, provide the right tools. And we really want to advocate for both intended parents, surrogates, and egg donors. But for the surrogate, we can kind of start from there. What would be the one piece of advice you think is most important for them to know?
Honestly, the most important thing is become educated, ask questions, because not everybody operates in the same way. And so you want to understand, what is ethical, what is not, consult with, multiple, surrogacy agencies, do your research. If you're able to get information from people in the industry or other folks who have gone through surrogacy, I would highly encourage you to check in, ask questions. It is important to be informed. Surrogacy is complex, and, as a mental health provider, I understand like where your heart is, like at the core, you want to help someone, build a family, but there's more to that. There's you, and you need to protect yourself, because it's complex and it can be dangerous. So I would say educate yourself, spend time doing research, even if it takes 6 months, to a year. If you're interested in surrogacy, take that long to do your research so that you can make informed decisions, and you feel comfortable about what you're getting yourself into. Along with that too is that you want to be communicating your desires about what you want to do with surrogacy to your partner or spouse if you are coupled. So building a support system. Like you want to make sure that you have this, because surrogacy cannot be navigated on your own. It is something that's just impossible for you to think that you can navigate this on your own. You do need a support network, and you need your spouse or partner, if you are coupled, to be on board with you on this, because again, it is a complex process.
Yeah, absolutely. I'm so happy we got to have this conversation. Thank you so much for taking the time. It's always a wonderful time speaking with you. So thank you so much, and hopefully we'll see you soon.
Thank you, Tina. Thank you so much for having me and for having this really important conversation with me.
Thank you. Bye, everyone.
Bye.